subsidy? A year? 5 years? Life? I don't even think the people who wrote the thing ever thought about this.
Well, I think the correct answer to that question is you would get the subsidy for as long as your income would qualify you. One of the issues, though, that comes into play is that everyone's been talking about the exchanges, and they tend to forget that there are lots of health insurance plans that are going to be off exchange. As a matter of fact, some of the largest health insurers in the U.S., like United Healthcare, are not offering health insurance in most of the exchanges. So you really need to compare plans both on and off exchange, particularly if you don't qualify for a subsidy. But also if you're a younger person who, say, is 300% to 400% of the federal poverty level, that's another instance where it would make a lot of sense for you economically to look both on and off exchange. And the other point I think that's very important for people to remember is that at the end of the day, health insurance is only as good as the doctors and hospitals that accept it. There's an increased use of narrow networks, that is to say, fewer healthcare providers serving more patients. So before you enroll in a plan, you really need to validate that your specialists or your primary care physician, or in the case of my wife and myself, where we have two very young children, pediatrician is included, because if you go out of network, you can face much higher costs, and you also don't have the protections on annual limits on out-of-pocket costs.
Well, devil's in the details. There are a lot of them. Thanks, Secretary Levitt, Kevin, and Rich. Great job, all. Really appreciate your time. We'll be right back.